Violence in the workplace, often unpredictable, most of the time random, it's happening more and more often. It's necessary to talk about it. There are programs designed to help workers deal with escalating violence in the workplace. Workplace violence is defined as any act of threatening or violent behavior, assault, harassment, intimidation, threats, disruptive acts occurring in the workplace. I remember specifically a time when I was a resident. I was in Houston, Texas in a county hospital, and one of the residents had a patient who pulled a gun out and pulled the trigger. Thankfully, the gun misfired, but it devastated the resident, and I'm sure that he's still having to deal with this. Was this preventable? Absolutely not. But we're seeing it more and more often, perhaps in emergency rooms. We're seeing it in mental health care facilities and home health care facilities. We see it where patients have had to wait a long time and develop a lot of anger in the emergency room. All we can do is educate our staffs, educate them about identifying patient behavior, looking for assaultive behavior, escalating violence, perhaps anger, and learning methods to diffuse it. You have to look for mood instability. You have to look for hostility, perhaps patients that have a history of head trauma, mental illness, perhaps they've been abused. Let's consider risk factors. Prevalence of handguns and other weapons. Remember, it's legal to carry weapons in some states. Increased use of hospitals by police for placement of acutely disturbed individuals. Patients' rights to refuse medications and hospitalization unless they pose a threat to themselves or others. Hospitals, clinics, pharmacies, all easy targets for robbers. Frustration and anger due to long ER waits. Often there's unrestricted movement through clinics and hospitals. Inadequate staffing or security in facilities. Lack of backup in high crime areas. There's lack of training in recognizing and managing escalating and hostile assaultive behavior. Employers can establish a zero tolerance policy. Secondly, they can train their employees to recognize assaultive and aggressive and potentially hostile behavior. And thirdly, they can implement policies to mitigate risk. At the end of the day, you have to understand your patient. You have to learn how to diffuse anger by listening to their family, speaking slowly and calmly. And finally, you have to exercise common sense and stay alert.